Virtual reality technology has come a long way in recent years, and it's not just changing the way we play games or watch movies. It's also revolutionizing the field of medicine in ways we never thought possible. From surgical training and therapy to pain management and mental health treatment, virtual reality is proving to be a powerful tool for improving patient outcomes and advancing medical research. And in this video, we'll take a closer look at how VR is changing the face of medicine and the exciting possibilities it holds for the future. So join us as we explore the virtual world of medicine and how it's shaping the future of healthcare. Number 1. PTSD treatment. Virtual reality technology is being utilized in a similar way to exposure therapy for phobias and anxieties to help soldiers suffering from post-traumatic stress disorder. According to a paper from the University of Southern California Institute for Creative Technologies, virtual reality has been used in PTSD treatment as far back as 1997, when Georgia Tech released a virtual reality simulation called Virtual Vietnam VR. In recent years, clinics and hospitals have been using virtual reality simulations of warfare, similar to the experiences of soldiers in Iraq and Afghanistan, to help veterans who are continually reliving traumatic events they experienced while on active duty. In a safe and controlled environment, veterans can learn how to cope with instances that might otherwise be triggers for destructive behavior towards themselves or others. The use of virtual reality simulations in PTSD treatment allows veterans to confront their traumatic experiences in a controlled setting, under the guidance of trained professionals. Overall, virtual reality technology is proving to be a valuable tool in the treatment of PTSD for veterans. Its ability to simulate real-life war scenarios in a safe and controlled environment can help veterans to confront their traumatic experiences and learn how to cope with them in a healthy way. Number 2. Pain management. Pain management is a critical aspect of burn treatment, as burn victims often experience ongoing pain that can be debilitating. To help alleviate this pain, doctors are turning to innovative methods such as distraction therapy using virtual reality. One such VR program, called Snow World, developed by the University of Washington, has been shown to be particularly effective in reducing pain during tasks such as wound care or physical therapy. The game involves throwing snowballs at penguins while listening to Paul Simon's music, which helps to overwhelm the senses and pain pathways in the brain. The immersive nature of VR allows patients to escape the reality of their pain and focus on something more enjoyable, which can help to reduce both the intensity and duration of pain. In addition to Snow World, other VR programs are being developed to help burn victims manage their pain. These include virtual environments that simulate activities such as swimming, skiing, and even being in a spa. The goal is to provide patients with a range of options that can help them cope with their pain and improve their quality of life. With the continued advancement of VR technology, doctors are optimistic that this innovative approach will become an integral part of burn treatment and management. Number 3. Exposure therapy. Exposure therapy is a widely used treatment method for individuals suffering from phobias. The therapy involves gradually exposing the patient to the source of their fear in a controlled environment, with the goal of helping them overcome their phobia. One innovative approach to exposure therapy is the use of virtual reality technology. Psychiatrists at the University of Louisville are currently utilizing VR technology to help patients with phobias such as a fear of flying and claustrophobia. The VR experiences provide a controlled environment in which patients can confront their fears and learn coping strategies. The VR setting is private, safe, and easily stopped or repeated, depending on the patient's progress. During the therapy sessions, patients wear a VR headset and are immersed in a virtual world that simulates the feared situation. For example, a patient with a fear of flying can experience a virtual flight in a safe and controlled environment. The therapist can then guide the patient through the experience, helping them to identify and challenge their fear-based thoughts and beliefs. By using VR technology, psychiatrists at the University of Louisville are able to provide patients with a safe and controlled environment to confront their fears and practice coping strategies. This approach can help patients break patterns of avoidance and overcome their phobias. The use of VR technology in exposure therapy is a promising development in the treatment of phobias and other anxiety disorders. Number 4. Surgical training. Training for surgeons is a long and rigorous process that typically involves cadavers and assisting more experienced doctors before eventually taking over tasks and bigger portions of surgeries. However, with the advancements in technology, virtual reality could provide another means of practice for surgeons, without any risk to real patients. Stanford University, for example, has a surgery simulator that even includes haptic feedback for those undergoing training. Since 2002, medical professionals have been able to benefit from an endoscopic sinus surgery simulation that creates training 3D models through the use of CT scans obtained from patients diagnosed. This technology allows trainee surgeons to gain hands-on experience in a safe and controlled environment, without the need for cadavers. Furthermore, the technology is so advanced that it can even simulate the sensation of cutting through tissue and bone, providing an even more realistic experience. The use of VR in surgical training is still in its infancy, but the groundwork that has been done at Stanford University could pave the way for even more effective virtual simulations in the future. This technology could revolutionize the way surgeons are trained, making it safer, more efficient, and more cost-effective. Number 5. Opportunities for individuals with disabilities. Virtual reality has been around for quite some time, and its potential for therapeutic use has been explored for just as long. As early as 1994, the New York Times reported on the use of VR in medical settings, highlighting cases where it was used to help children with cerebral palsy and cancer. One example detailed a VR experience that allowed a 5-year-old boy with cerebral palsy to experience the sensation of moving through a grassy field in his wheelchair, while another example described an animated fish tank that allowed 50 children with cancer to swim around in a virtual environment. In recent years, the technology has continued to evolve and has become more accessible to a wider range of users. Headset maker Fove, for instance, has undertaken a crowdfunding campaign to create an app called iPlay the Piano, which uses the headset's eye-tracking technology to allow children with physical disabilities to play the piano. This is just one example of how VR is being utilized to enhance the lives of those with disabilities and provide them with new opportunities for expression and engagement. Number 6. Mental health. Meditation can be used to relieve general anxiety. Deep, a new Oculus Rift program, attempts to teach players how to take deep, contemplative breaths by making respiration the only control for the game. The app works in conjunction with a chest band that measures respiration. The VR sensation is similar to being submerged in water. Breathing is what transports a user from one location to another. Another advantage of the game is that using breathing as a controller helps individuals who would otherwise be unable to use a joystick or controller to participate. Number 7. Evaluating and treating brain injuries. In a very short amount of time, virtual reality has developed into an effective instrument that can not only diagnose impairments but also cure them. A recent study published in Cyber Psychology and Behavior highlights the potential of VR in this field. One of the examples discussed in the paper is the use of virtual reality for assessing and treating impairments in executive function. Executive function refers to the ability to sequence and organize behavior and includes problems with planning. To test this, scientists designed a virtual reality experience in which participants had to navigate through a building, using doors of different colors to reach the exit. This experience was designed to mimic the Wisconsin card sorting task, a neuropsychological test that measures cognitive functions such as attention and problem solving. The results show that the VR experience was just as effective as the traditional test and may even be more ecologically valid. This suggests that virtual reality has the potential to revolutionize the way we assess and treat impairments in executive function. Overall, VR has come a long way since its early days and has proven to be a valuable tool in the medical field. It has the ability to provide patients with a sense of freedom and control over their environment, helping them to cope with their conditions and improve their overall quality of life. As technology continues to advance, we can expect to see even more innovative and impactful uses of VR in the medical field in the future.